And Don, you're doing roll call, right? We don't need to, do we need to like anybody say anything?
If you'd like me to, I can go through it. Otherwise, I'm just tracking people.
That's fine. Yeah, as long as we have a record. So any announcements? Does anyone have any announcements? All right, well, I guess we'll just jump right into it then. Christy, looks like you're giving the report from Ramsey County Girls.
Hi, everyone. Yes, both myself and Shakira. Good morning. It's good to see you all and be back. We are going to be sharing a report. There's a couple of things I just want to go over before we get started, and then it would be helpful if we could just do a quick round of introductions so we know who's here, and then we can sort of jump into our introductions and the report out. Is that okay?
Yeah, absolutely. Hi, Shakira. I don't know if you remember, we had dinner the night before the conference, the last conference.
I do.
See you again. Yeah. Okay, so I'll start. We can just do maybe the in-person, and then we'll go around to those who are online. I'm Vicki Hunter, and I'm a professor at MSU, and I also am the director of the Scholar Serving Time program, which is the college and prison program at Shakopee.
Good morning, I'm Crystal Bracke. I'm Deputy Commissioner of Client Services and Supports for the Department of Correction, and I'm Commissioner Schnell's liaison to the task force.
Good morning, I'm Jeff Spies. I'm a program director at the correctional facility in Shakopee. I oversee case management and elective programming.
Yeah. Paula, do you want to start with the online and then popcorn? So just say who you want to go next, please.
Sure. Good morning, everybody. I'm Paula Schaefer. I'm retired. I'm happy to see Shakira and Christy here, and just so excited about this fabulous, the best report in the world on girls, my opinion. Tanya?
It's Tanya. Do you mean Tana?
Tana.
Oh, I'm sorry, Tana.
That's okay. That's okay. Hi, I'm Tana. I get all sorts of stuff. Good to see you, Christy. Welcome back. What are we saying? I'm a mental health professional, social worker, therapist. My background is working in the juvenile justice system as doing therapy and trauma-informed care there. So yeah, I will popcorn it to Linda.
Good morning. My name is Linda Flanders, and I'm a county commissioner in Goodhue County, and I am the liaison for the Association of Minnesota Counties.
Keela Marie, do you want to go next?
Sure. My name is Keela Marie Granda. My background is in criminal justice, particularly in intervention, prevention, and rehabilitation. I'm also a subject matter expert, and I work with DAS and DCYF on issues around trafficking, recidivism, child welfare, etc. And I've been on the task force for about 3 years now.
Nazra, do you want to go next?
Sure. Hi, my name is Nasra Hassan. Hi, my name is Nasra Hassan. I'm a legal advocate from the Minnesota Disability Law Center. I'm grateful to be here.
Angela, did you go?
Yeah, hi, good morning. My name is Angela Thompson. I'm an OBGYN, and I have been on the task force about 2.5 years. And I have experience treating women who have been incarcerated. And I will popcorn to Savannah.
Good morning, I'm Savannah Riddle. I'm the Maternal Child Health Section Manager at the Minnesota Department of Health.
Abby, do you want to go next?
Good morning. My name is Abby Wakilius. This is my first task force meeting. I'm the new MCAA I'm representative to the task force. I'm the Lyon County Attorney.
Lauren, I think, is it gone yet?
Good morning, I'm Lauren Zidon. I am the juvenile investigator for the Ombuds for Corrections office.
Angel?
Good morning. I'm here having some trouble with service and computer this morning. My name is Angel, and I am person lived and experience.
Okay. Don, would you please click? Sorry, I didn't mean to
Oh, no.
jump over you.
You're good. I'm Don Click. I work with the DOC and I staff for the JWIC committee.
All right, I believe that's it. Did I miss anybody? All right, so Shakira and Christy, you're up.
Give me 1 minute to share my screen.
I thought they didn't hear me.
Do you see my screen?
Yeah, we can see it.
The presentation? Yep. Okay, perfect. Okay. So the purpose of today's meeting is first we'll provide a background on the development of the girls' reports. And second, we'll review findings and discuss their implications. And then together we'll look at what the data reveals about girls across systems and what that means for our work moving forward. We'll also provide an update on a metro-wide planning grant that we have applied for and what we hope to do with that if awarded. So just a little history before we jump into the actual report, and I hope you'll find this helpful. So Minnesota has long recognized that girls in the justice system have distinct needs. The Minnesota Parity Statute established that girls must receive programming substantially equivalent to boys, but also designed around their specific needs. This statute was the early recognition that equal does not mean identical and that girls require gender-responsive services. Despite this requirement, many communities have continued to face limited options in programming designed specifically for girls. Today's work builds on this foundation by moving from parity towards intentionality, designing systems that center girls' experiences and needs. One other piece, in 1994, Minnesota recognized the need of gender-specific services for girls in the justice system through this omnibus bill. The law directed state agencies to work together across systems, corrections, human services, health, education, and public safety. The goal was to create a comprehensive continuum of care designed specifically to meet the unique needs of girls. This legislation laid out the early foundation for cross-system collaboration and gender-responsive services in Minnesota. Again, today's work builds on the vision by intentionally designing coordinated services for girls across the system. We all will do better. And then this is a quote from the 2002 Minnesota Action Plan for Female Offenders. Again, talking about how girls are often at the intersections of many different systems. Public health, human services, child protection, juvenile justice. Their involvement in these systems is rarely isolated, and it's often the result of trauma, instability, exploitation, and unmet behavioral needs. Our report findings will highlight all of these things are still true and still happening. Because of this, how systems respond to girls and whether they recognize their gender-specific and cultural needs matters significantly. When systems operate in silos or fail to address those needs, they can unintentionally perpetuate cycles of poverty, trauma, system involvement, and family instability. When systems collaborate and intentionally design responses for girls, they have an opportunity to interrupt those cycles and support healing, stability, and opportunity. Again, Minnesota has a long history of recognizing that girls and women have distinct needs. I'm not going to go through all of this timeline. We'll send you these slides, but there has been a long history of that has laid the groundwork for this report. These reports that we're about to jump into could not have been done by a small group of people. You will see that this took a lot of people to do the work. We aren't always able to have everyone present who has been part of the report just because of timing and different things. So Lola, who isn't here today, is the Executive Director of Partnership for Permanence. She has a local nonprofit in Ramsey County that really works with young people who have aged out of the foster care system and equips them to be change makers in their communities. So Partnerships for Permanence was a part of an important part of these reports that we will get into in a little bit. And then I'm going to turn it over to Shakira.
Great, thanks. Just a really brief introduction to the organization that I work with. Again, my name is Shakira Washington. Pronouns she, hers, for those that are, do that. Basically, I am Vice President of Research for an organization called Justice and Joy National Collaborative. We are an intergenerational gender and racial justice organization. We've been around for more than 140 years. And we actually are probably better known as National Crittenden Foundation. And we also had another iteration of that name as well throughout our history. Basically, we work primarily with girls, but also gender expansive young people. We also work with boys through our direct service programs, but a large proportion of the young folks that we work with are girls and gender expansive young folks. And we primarily work with those that are impacted by many of the issues that Christy just mentioned. Basically, young folks who are challenged around education systems and staying in school, being disconnected from school, young folks who are involved in the child welfare, juvenile justice systems, young folks who are challenged around homelessness or lack of adequate housing, young people who have been impacted by more than their share of adversity and unfortunately violence. And so we really sort of work to engage programs, policymakers, systems in addressing their needs in a more proactive way, one that really is focused on health and healing. We actually ran across, our president has known Christy for a number of years, but we really started beginning our work with Ramsey County probably maybe back in 2018, and then really kicked into gear around 2020 when our organization was directing through a cooperative agreement, the National Girls Initiative. And this cooperative agreement was with DOJ's Office of Juvenile Justice, Delinquency and Prevention. So that's just sort of a little bit about us and kind of our background. I could probably tell you more and go on forever, but I won't. But definitely look us up on our website, Justice and Joy National Collaborative. And we'll just move on to the next slide.
Great. So for the past 5 years, Ramsey County has partnered with Justice and Joy Collaborative and Partnerships for Permanence to better understand the experience of girls impacted by our systems. When we say girls, we're using the term in the most inclusive way possible, cis and trans girls, as well as gender non-conforming young people. This collaboration produced 2 groundbreaking girls reports, which will be publicly released soon. The first is a quantitative report, which provides a data-driven picture of girls' pathways and experiences across our systems. The second report is a qualitative study centering the lived experience of girls and their families who have interacted with child welfare and juvenile justice systems. That research was led by P4P, Partnerships for Permanence, young women whose expertise and lived experience uniquely position them to conduct this work with authenticity and depth. We are grateful for their leadership and partnership, and we're excited to continue to work alongside of them to shape what comes next. This work reflects years of extensive data analysis, local and national level expertise, and deep engagement with Ramsey County girls and their families through interviews and focus groups. It represents one of the most comprehensive examinations of girls' system involvement ever undertaken. Ramsey County is the first jurisdiction in the nation to look at girls' involvement across systems with this level of upstream depth, clarity, and intentionality. And then just as I had mentioned really quickly, you can see that this took a lot of work and we've had a large number of partners across departments, divisions, and community organizations. This report wasn't something that any one team could have done alone. The data lift behind the report was extensive, pulling records across systems, cleaning and matching data sets, reviewing individual case patterns, and validating findings with both national experts and local practitioners. It required a level of collaboration and persistence that truly reflects the best of Ramsey County and the community. We are incredibly grateful for the support and expertise that so many partners contributed to this report. Their commitment made it possible for us to understand girls' experience with a depth and accuracy, and it is their partnership that will make this next phase of the work both credible and successful. So I will turn it over to Shaq.
All right, great. So the reality is any study, while this study was large and went on for an extensive period of time, the reality is you can only answer but so many questions in a study. You can only look at but so much data. And I always say that really the true stories of what is happening with girls, gender expansive young folks, as well as boys, is oftentimes really sitting inside those paper case files. And unfortunately, we weren't able to go through and do sort of a case review, and that is something I would definitely recommend for the future. But we were able to unearth and uncover a number of things through this particular study. Maybe we should go on to the next slide. So as Christy mentioned, and the other thing that I wanted to note was that oftentimes, I believe Christy said that oftentimes this committee also works and discusses issues around women moving through the correction systems, is that oftentimes, I used to do some work with another organization earlier, but they were working with adult populations and communities. And just about all of them had said that at some point they had touched the child welfare as well as the juvenile justice system. So, if we think a little further upstream, what does that mean looking downstream, right? So if we're able to catch and provide services that really meet young people's needs when they start touching these systems, then we really have a much better opportunity to reduce their presence in our adult system. So I just wanted to put that out there because I think there's some folks online who specifically focus on those populations. So again, this study included 2 separate studies. One was focused on looking at quantitative data, basically looking at over 8,000 cases of girls and boys across Ramsey County's child welfare and juvenile justice system. Again, as Christy mentioned, it was highly collaborative. We also had 3 specialists, Karen Worthington, who is a child welfare specialist, Francine Sherman, who is a juvenile justice specialist with a particular focus on girls, and Scott Roach, who is a statistician out of San Diego State University, also helping us to really pull together, tie together all of the data that was coming out of Ramsey County and helping us to do the analysis and determine what questions to ask. So the quantitative study really focused on, one, the data that was available to us, that was cleanest to work with, and we really were interested in looking at disproportionate contact, and we were also really interested in looking at some differences between the 2 genders, as noted in the data, but also specific outcomes that were happening with girls. And that was One being absent without permission. As we all know, girls have a tendency to run. This is a big part of their backgrounds. Dual system involvement. We were interested in looking at detention, incarceration amongst this group of young folks, as well as recidivism. When it came to the qualitative report, again, as Christy had mentioned, highly collaborative, with, partnerships for permanence really sort of leading this work. And we were really interested in sort of answering specific questions through this qualitative research study. And there's a ton of questions that still need to be asked. But we unfortunately really needed to, kind of limit ourselves. And by working with young folks, we had determined that people were really interested in knowing more about how the systems impact young people and their families. They wanted to know more about the sense of safety and system involvement. They were really interested in better understanding how young people and families were perceiving sort of system engagement and systems approaches, their experiences with transition planning, especially for young folks, as well as the types of services that were being provided by systems from the perspective of parents. Let's move to the next slide. In terms of the qualitative report, there were really some key findings that I'm going to sort of lift up just through our discussion today. Again, the reports are about 60 plus pages each. I would recommend reading those reports. They go far more in depth with all of the findings that we were able to look at. So again, continued racial disparities and disproportionate contact across systems for certain communities. Sexual violence and other abuses continue to be a serious issue when we're talking about girls. While it happens amongst boys, the rates are significantly higher among girls. Girls are significantly more likely to be absent without permission or to run from various systems, resulting, unfortunately, in even poorer outcomes. Congregate care continues to be used almost at the same proportion that we use other out-of-home placement possibilities. And unfortunately, congregate care was also connected with a number of negative outcomes. Girls are significantly more likely to enter the correction system for lower level offenses when we compare them to boys, and they're also more likely to be dual system involved. One thing that we did find, which is really good news, is that the most needy of girls account for a much smaller percentage of young folks touching these systems. And we'll show you a chart later, but really about 80% of young people who start off in child welfare eventually, sort of touch the system and then move out, which is really positive for Ramsey County. The question is what do we do with those most high need young people? And who are they? So let's go to the next slide. So again, one of the things that we were really interested in is better understanding racial and ethnic disparities and disproportionate contact across different systems as well as across outcomes. These findings, unfortunately, are not new, but Black, African American, and American Indian and Alaska Native communities, unfortunately, as well as other communities of color, continue to be disproportionately represented amongst child welfare as well as Ramsey County Community Corrections. As you can see from the top lines, Black African American communities in Ramsey County account for about 11 to 12% of the entire population in Ramsey County, and yet they account for 32% and about 32% of the child welfare social services systems, while 54% to 55% of community corrections. While American Indian and Alaska Natives account for a very small proportion of Ramsey County, about 4% of the total population, they account for about 9.9 or about 10% of child welfare social services and about 11% of community corrections. Again, this is just an example of disproportionality and something that we need to keep an eye on. Let's go to the next slide. And also when we start looking across the different outcomes or experiences that we were sort of interested in, and this data also looks at other outcomes, but this particular chart looks specifically at experiences with out-of-home placement. That's the OHP. Young people who are more likely to run, so absent without permission, or AWP, those who are more likely to become dual system, and those who are likely to be detained or incarcerated. Again, Black, African American, and American Indian and Alaska Natives jump to the very top when we're looking at this data. So we really are clear that we really have some challenges around these two particular populations in Ramsey County. And something that we need to continue to work on. And I know that there are a lot of reform efforts already occurring in Ramsey County. So really this report, just sort of reiterates the need to continue this work. Let's go to the next slide. So one of the things that we're always unfortunately interested in having a better understanding is the experiences around violence and abuse when it comes to girls and gender expansive young folks. As we all know, so I'm sure everyone's heard of the ACE study, basically the Adverse Childhood Experiences Study. As we know, as these experiences tick up, the outcomes of those who have those experiences often decline when it comes to behavior, mental health, and physical health in the future. So, and we also know that for girls and gender expansive young folks, especially girls, we know that there are certain types of abuses that seem to be a part of a larger proportion of their backgrounds. So just looking at young folks with neglect, child abuse and neglect cases, what we find is that girls, their rates around abuse as a whole, when we just look at the entire population, including boys, we see that girls represent a higher proportion for these key types of abuses: sexual abuse reports, sexual abuse determinations, physical abuse reports, as well as determinations, as well as reports of neglect. So across all 5 of these indicators, we find that girls are significantly higher in terms of proportion than when we compare them to boys. Not to say that it's insignificant for boys, but we just note that this is significantly higher. So let's go to the next slide. Now, when we look within gender, so when we look at the category of girls, the category of boys, we find that reports of sexual abuse and determinations as well, sexual abuse seems to really stick out for girls. So amongst girls, there's about 29, almost 30% of report sexual abuse that bring girls into the system, and about 14, maybe about 15% that are actual sexual abuse determinations. The numbers are also high for boys, but they are significantly different when we're looking at girls. When it comes to neglect reports, boys have a tendency to be, the proportion of boys is significantly higher than that of girls. The reality is for both populations, sexual abuse and determinations are probably underrepresented, underreported, really for probably both populations. But we know, as because we have a number of service providing organizations, we also know that many of the girls that we talk to, the numbers around sexual abuse and physical abuse are much higher than even the statistics that we're looking at here. So so really what's happening is more than likely we probably are experiencing an underreporting of what's happening with young folks, which is very common with this type of data. But I just wanted to point out these differences between gender. So let's go to the next slide, and I'm gonna try to tick things up just a little bit because I know we're running out of time. So when it comes to out-of-home placements, Ramsey County is actually doing really well. Close to about 60% of young folks have, 2 or fewer placements, which is a good indicator, right? So this means that basically young folks are sort of touching the system, and then moving out very quickly in terms of out-of-home placements. And it's really only a small percentage or proportion that are having 4 placements or more throughout Ramsey County. Let's go to the next slide. So one of the things that we also were really interested in, we also know that many systems really are trying their best to use sort of home style placements for kids, because we know that they often do much better. Congregate care is one of those placements that we really try to stay away from. However, in Ramsey County, what we're finding is out of all the young folks who are, or out of all the girls who are placed in out-of-home placements, 50% of them are still touching the congregate care system at some point or another. So this is one of those areas that we need to continue to work on because unfortunately there are a number of negative outcomes that have been associated with congregate care. Let's go to the next slide. So again, when it comes to out-of-home placements, again, young people, girls of color are overrepresented, specifically American Indian, Alaska Native, African American Black youth, as well as multiracial girls were disproportionately represented among young people experiencing out-of-home placements. We also noted when we sort of looked at other outcomes like running away or being absent without permission or being dually system involved, that a high proportion of these young folks actually had experiences or histories of being in out-of-home placements. And we also noted that a large portion of these young folks had also touched the congregate care system. So again, it's important that we take into account how is out-of-home placement impacting girls, especially congregate care. We also find that young people of color are also disproportionately are more likely to re-enter an out-of-home placement after being reunified when compared to their white peers. So again, we need to ask some questions. What is happening around these types of disparities in service delivery? Are we really meeting the needs of these children and families? Next. So absent without permission, we find that, maybe about 50% of girls, take off, run from a system setting. While, this is good news. We don't want them running at all, but this is good news that about 50% are only doing it one time. However, it's the events that happen 2 or more times that we really need to pay attention to. First, girls are significantly more likely to run from systems when we compare them to boys, something that we need to also pay attention. So what is happening in terms of services and programs that girls are taking off and boys are less likely to take off? Let's go to the next slide. And one of the reasons why we're really concerned around this is obviously young people find themselves in more challenging and dangerous situations when they are running and on the street. And what we found is we were able to look at and compare the maltreatment reports and cases and determinations for girls that had never gone absent without permission to the rates among girls pre-absent without permission to their lifetime absent without permission rates of exposure to violence. And what we found is that there's a clear significant difference between those who had never run and those who eventually ran, but also between those who eventually ran and then at the end of our 4 or 5 year period of looking at the data, that these numbers increased substantially. So for example, girls who did run, while 70% had at least a maltreatment report, by the end of their time in social services, about 81% had these experiences. And this occurred across each indicator. So average number of maltreatments increased substantially. Sexual abuse reports increased substantially, et cetera, et cetera. So we know that being absent from the system and being unaccounted for is a dangerous situation happening with girls. Let's move to the next slide. So when it comes to community corrections, girls, again, are significantly more likely to be dual system involved when we compare them to boys. So close to somewhere between 55 and about 60% of girls were dually involved who had touched the community correction system compared to about 40% of boys. This is not unusual data. We know this nationally. We also know that girls are more likely to find themselves touching the system for lower level offenses, such as disorderly conduct type offenses, as well as misdemeanor offenses compared to what is happening with boys. So we need to start asking ourselves, how can we better push girls away from the system? How can we better address the needs of girls and young folks who are touching this system that address their specific needs that have them engaged in these types of behaviors? This is an indication that I need to speed it up. So again, going back to let's just go back to the
time. We have like an hour. We had an hour, I thought. So 20 minutes still.
Okay. I could get a little chatty. And so let's see, where was I? So again, lower level offenses, around 45% of girls experience some level of detention or incarceration. And this actually is across systems. So girls are touching sort of like the correction system, even when they're in child welfare. And it's more than likely because they're being absent and they're being arrested for being absent from the system. But this is a combination of both correction and child welfare, social services. So about 45% of girls, sort of take off or become involved with the correction system. Let's see. So also only about 26% of girls who do come into community corrections actually recidivate. And I believe our numbers indicated that that only Black and African American girls were the ones that were recidivating. They were the only ones amongst this population. And let's see. We also found that about 193 of the young folks in community corrections were dually involved, which I mentioned before. About 77% had a history of maltreatment, and 56 or 57% had a history of being in out-of-home placement, with, again, another about 45% actually touching congregate care. So let's jump to the next slide. Okay, so we did this thing called a latent class analysis. And basically what you do with the latent class analysis is you throw in a series of indicators that you're interested in so that you can kind of see, well, how many young folks are sort of falling into different or similar type categories. So basically what it does is it looks at all these indicators and it says, oh, this group of girls seem to have these types of similar indicators or fall into these same types of behaviors or categories. It then looks at another group of young folks and it says, oh, and this group seems to have very similar indicators, et cetera, et cetera. And basically a latent class analysis can run from one class to who knows, it can go on and on. But what we found when we looked at the girls who were touching social services or child welfare is that we had about 3 classes of girls that were really sort of looking with very similar indicators that were happening amongst them. Again, as you can see in class 1, they are the least likely and the highest number or largest number of girls to touch the system and then leave. So it's around 80% of girls quickly touch the system, we're able to figure out what's going on with them, and then they leave the system. However, class 2 and class 3, as you can see, when you sort of look at the different indicators that we were looking for, that a much higher proportion of girls begins to really to bubble up, that these girls really are of serious high need, and that these are the girls that we really need to pay attention to when it comes to service delivery. And let's jump to the next slide. So those were just some highlights from our quantitative report. Again, read through it. There are some other findings that are there that you may find of interest. When it came to the qualitative report, there were a few key findings that we had, and I really was hoping that Lola would be here to really present and dig into these findings. But overall, what we found, so this particular study, we spoke with girls, gender expansive young folks, as well as parents who had either been involved in Ramsey County Social Services, community corrections, or both. And we really wanted to know, again, what their experiences were and some of the things that really bubbled up to the top that were really problems that we can continue working on is lack of communication between families and the systems. Over and over again, we heard from participants that they weren't really clear about what was happening in their lives, right? They weren't really clear about what the processes were, and they really needed to have better communication from system workers so that they could better understand what the next steps were, how they should be, moving in terms of meeting the requirements of these systems. There were also lots of complaints of non-inclusive case planning and decision-making. They both, young people as well as parents were saying, oftentimes we felt that the systems were sort of acting upon us, but not really engaging with us and helping us, including us in some of the decisions that were being made. So oftentimes maybe a young person would be like, I had no idea why they were coming to pick me up, so I took off, right? So the question is how do we sit down with young people? How do we sit down with families and say, hey, these are some things that we really need to talk about. This is why we're thinking about doing this. Do you think this will actually meet your needs and what is happening? Oftentimes, maybe you just have a family that's so stressed out because maybe mom has several kids, which is a case of one of the people in one of the families that was in this report. She was going to school, working full time, and had 5 children. And things were getting out of control. And she felt, all of a sudden, next thing you knew it, she found herself in the child welfare system being surveilled. And yet she kept saying, if they had come in and said, we're here to help you, what do you need? Let's work this out. She said that she would have felt much better. She would have felt that the system really cared about what was happening with her instead of forcing her to actually adding really probably to some of her struggles. So this was sort of an ongoing thing that we kept hearing throughout our conversation. So better inclusivity in planning and decision making. Also, again, that really bubbled up was the lack of crisis interventions and responses. Over and over and over again, especially with parents, they kept saying, my child is having a real behavioral and mental health crisis, and I cannot seem to get timely and effective services for my child. I call one place, they say, oh, we know you. Sorry, we don't take your child because their issues are above our grade. Call this next person. They call that person, then they're forced to call the next person. So really making sure that we have services and programs that really are crisis interventions that are able to respond very quickly and in a super timely manner. Delayed service delivery and again, crisis responses. Again, families talked about, they said they were going to get us this service in November. By April, we still didn't have the services. So how do we ensure that we, have enough and available services that when they're needed, we're able to pull families into those services quickly? Because many of these families really are under duress. Let's go to the next slide. So another thing is that a lot of families, even though I know that we try to provide a lot of supports around families, a lot of them continue to say, really, because we're dealing with issues of stigma, really many people around us don't really understand what is happening with us. Both children and parents said, really, they lacked social supports as well as networks. And they really oftentimes found themselves feeling as if they were kind of out there on their own. And really, most of them said, where we do find supports are with other children or young people and families that are going through the same situation that we're going through, because they really are the only people who can understand. So how do we begin to build up those types of services even more? Also, unfortunately, when it came to families, when it came to parents, there was a sense of continued criminalization and feeling of stigmatization. There was also, people talked and discussed about the lack of continuity of care and empathy by service providers. So, over and over again, young people, parents talked about, well, we had multiple social workers and I had to continue to repeat what was happening with me over and over again. So, and the ones who did have continuous social workers, really empathetic and caring social workers, always said, that was what changed the tide. This is what made the difference. This person knew me. They knew our issues. They were, there from this point in time all the way until, the end. And we were able to feel comfortable with them and things were, were positive. We ended up more with a positive ending versus those who continued to say, I had 5, 10, different social workers, things kept going. I had to keep repeating my situation. So this continues to be a problem. A continued gap in services and programs, and especially with respect to intersecting identities. Again, these reports were really focused on what was happening with girls and gender expansive young folks moving through the system, because too often we want to take a non-intersectional approach to every single person, parent, child. They each one said, if someone comes to me and says, what are your pronouns? They say, I instantly feel comfortable. When somebody acknowledges my sexual orientation, I immediately feel comfortable, because these are really important factors for for people who are touching these. These are really important factors for all of us, but especially for young people and families that are touching these systems. Services have to be responsive to the realities of young people in an intersectional way, families in an intersectional way, and they need to be understanding. So this was really a very important piece of this particular report, and especially given that we know that rates of violence and abuse are especially high for this particular group of young people, and we need to make sure that we have trauma-informed, gender-responsive, culturally responsive, et cetera, type services. So going very quickly, I think that's my last slide. And I'll turn it back over to Christy.
Yeah, thanks. And so just really high level, and then we can turn it over to questions. The data suggests that understanding which girls are more likely to experience specific outcomes can help Ramsey County systems provide more appropriate and effective interventions. As we heard in the data, there's about 20% of girls who are really struggling in our systems, who we don't have the right resources that are gender and culturally and trauma responsive. And if we can focus our efforts on that 20% to make sure resources are available to them, we believe that that will impact the other 80% as well. That population, once we have the right resources, will also benefit. For instance, knowing that girls removed after age 10 are significantly more likely to be absent without permission should trigger enhanced support rather than standardized placement procedures, which is what we're seeing. So just real quickly, this is a high level overview. A lot of you work in these areas, but the key priorities for Ramsey County as we move this work forward are earlier intervention, so identifying these girls and families earlier on, upstream prevention. So I hope for those that work in the juvenile justice space that you can see that by the time the girls get to the spaces that you're at, that you're providing care for, they have gone through significant amounts of trauma. And without trauma responsive, without understanding the sexual abuse histories, the sexual violence histories, in my experience working in facilities, that's why girls run. I always ask, what are you running from, or what are you running to? That the answer to that question will help guide what services are needed. And this report really gives us an opportunity to look at this data upstream and say, what are these early upstreams programs and services that are needed? And then really importantly, centering lived experiences of young people. We heard that in these reports. It will be an important part of our work moving forward. We're really happy to be working with Angel, who is part of this task force, on some next steps that I will highlight. But, we know that the youth and families and the girls who have experienced these systems, they know what they need. And in all honesty, they're not asking for a lot. And so it's just a matter of providing opportunity and really listening and hearing what they're saying on what those efforts are needed. And then again, using the data to inform our decisions. We've spent resources in Ramsey County on 20% of population for maybe a carjacking pilot or familiar faces or things like that. We have a history of doing small pilots, and this is another area in which we're looking to focus efforts. And then just really quickly, the Department of Children's, Youth, and Families has a critical opportunity, a grant application that was due at the end of December to strengthen community mental health supports for youth who are at risk of entering, involved in, or transitioning from the juvenile justice system. The project aims to create safer, more supportive environments that foster resiliency and healing. Justice and Joy, in strong partnership with Ramsey County, applied for a planning grant designed to lead a coordinated effort across the Twin City metro wide to build a continuum of care for girls. So Our application that we propose to DCYF would be to use the findings in these reports to gather leaders from the metro counties to say, we know we have the data, we know who the girls are. We also know that these girls and these families, because of the instability, bounce around from county to county. Our girls in Ramsey County have been part of Hennepin County systems, have been part of Dakota County systems, and really feel that this planning grant would be an opportunity to bring counties together to say, what can we do for girls? We do not believe that any one county can solve what is needed for girls. Collectively, we can do that using this data. We're hoping the award notice will be soon, and we will get to work working with other counties that want to opt in to look at what we can do for girls across the continuum of supports that are needed. So I'll stop there. We'll open it up for questions.
Yeah, well, first, Christy, and Shakira, thank you so much for this report. Wow, what a comprehensive study. This is amazing, really amazing. And thanks for coming here. I guess I'll start quickly. I have a couple of questions. Did your sample consist of all of the clients of both of the organizations, or like all the percentages you were providing? Like, what is the broader sample that they're based on, I guess?
Right. Yeah. So we actually, Ramsey County Social Services and Community Corrections were absolutely incredible in this process. But the data came from young people between the years of 2018 to 2021, between the ages of 12 up to the age of 18, who had that were involved in the systems, right? So we first started off with child welfare. We pulled literally over 8,000 boys and girls who were in the system at that time, and looked at their histories. So we actually not only had their from when they touched the system, between 2018 and 2021, but we were able to look backwards to see had they been in the system before. So we were able to look at that data as far back as it was kept, because at a certain point, each county eventually has to archive their data. So we were able to look at least 5 years back, but then we were able to look all the way up until 2021 when the data ended. So there were 8,000 youth. So all of those percentages is focused on those 8,000 young people that were involved in social services and community corrections. Now, the community corrections young folks, we actually pulled by matching. We wanted to, basically they were all like within probation. And we also matched across systems, which was a incredible feat. So they looked at social security numbers, dates of birth, and matched young people so that we knew, had this child touched child welfare at some point and then moved over to corrections. So that's where all of that data comes from.
Okay. And then could you just quickly, is congregate care, is that a group home or institutional setting? What does that mean?
That's correct.
Which one?
It's I believe it's the combination group homes and
all of it.
Yeah.
Okay.
Exactly.
Yeah. Other questions?
And
yeah, sorry.
Deeper, so if there's another, I think, so Karen Worthington had developed in the definitions, it's in the back of the report. So she fully defines what is meant by congregate care. I unfortunately don't have that information like right in front of me, but all of the definitions for those variables are set in the back of the report. But, other placement settings, basically it means, relative or non-relative. So those were more, right.
Okay.
Exactly.
That makes sense. Angela, go ahead.
Sorry, thank you so much for that report. I'm just curious, in terms of the data you mentioned about sexual violence occurring and impacting both girls and boys, where is this occurring? Is this prior to entry? Is this during the care, especially in group settings? Like, where is this occurring? And are the data able to parse that out?
So the data was not able to parse that out. So we were looking at reasons for why a young person had a case or filing in child welfare. So that was basically either a sexual abuse report, and then we would look to see a sexual abuse report, a report of neglect, a report of physical abuse. We then were able to also to look to see if there are actual determinations based on those reports. So what we, ended up doing, because some kids actually had multiple reports, right? So those are counted within those percentages for both boys and girls. So that's why the percentages don't add up to 100%, because a young person may have had a combination of physical abuse, a sexual abuse report, a neglect report, and then maybe somewhere down the line they had another report, right? So we sort of added, it was too hard to tease out, and we wanted to make sure that we accounted for all of the different reports.
Yeah, trying to get a message.
So those reports could have happened prior, but also during system involvement as well. But what we did find was, as you could see when it came to the absent without permission data, is that reports, you could see that a lot of the girls had already been involved with the system, and they also already had sexual abuse reports. But then when we looked down the line, those reports increased for young people who actually ran from the systems. So I believe it's a combination of, prior to touching the system, and that's what led them into the system, as well as additional reports once they were in the system and further down the line.
Okay, thank you.
Sure.
Other questions or comments?
I have a question. Thank you both so much for sharing all of this. Really impressive with the quantitative and the qualitative, like seeing it together. And I agree with what you're saying, Christy, like this is representative across the country. So thinking about us, right, as a task force for women and girls, what can we do? Like, we have all this information. I hear that you guys are, you've applied for this grant, like, and maybe that's not something you answer right now, but I'm just curious. I know it's something that we talk a lot about here, and kind of like, what's the task for us, I guess, if there is one?
I guess I would say, as someone who has been was part of the task force for 10 years, be intentionally focused on girls as you are about women, because these are who the women become. I know 2 at Shakopee personally, right now, that grew up in this system. And so it's important that the work is intentional. I know, a lot of the work around DOC is that they license facilities. They're not responsible for a girls' facility per se, but girls are in DOC licensed facilities, and I think there's an obligation there to make sure that the programs and services that are being offered are reflective of what the girls need, and what this data says they need likely isn't being offered. I know it is in some places, but programs like Not a Number that are sexual violence prevention, healthy relationship program, crisis management, trauma responsive programming, all of those programs and services that help victims of trauma heal are what are needed inside of those facilities. And I think that that's lacking. And I think some push around the licensing piece of DOC and being responsible for what happens inside those facilities would be a good start.
And one of the things that we push as an organization, I think almost wherever you sort of sit in the process, you literally see the pathway of, young people almost from the time of birth, all the way through, even into adulthood. And if we could figure out ways to help systems work more collaboratively, whether we're at the point of prevention, early intervention, or if we're at that point of intervention, it's really imperative that people have an understanding of all the different touch points, right? So, young people, adults, if you're in education, how you succeed is also impacted by your mental health and your health, right? So how do these two systems work together to ensure that the needs of folks who've been through a lot are actually being addressed? So if we're sort of like, I don't understand why they're failing in this job program, like, why can't we keep their attention? Maybe it has something to do with something else that maybe a different system is required to engage in. When it comes to housing, for example, like how do we work with housing? Because I know amongst young people, one of the big issues is lack of secure housing. So one of the things that we've come to realize is, DOC or DOJ or, the justice system, correction systems can't work and ensure that the needs are being met for these communities if we don't include the Department of Housing or people who provide housing services, right? So really, if we can all figure out ways to sit together and talk about, how all these issues, like Christy mentioned, how all of these issues intersect, then I think we can come up with some better and more effective services and programs. So I'll just kind of toss that there.
Yeah, Linda, go ahead.
Thank you very much. Well, just to follow up on what Shakira was saying, I came from San Francisco. I was a police detective in child sex abuse. And what I noticed is, so my point is to get law enforcement on board as well, because I would see the victims come through, and without any early intervention for small children, then I saw them coming back around a few years later as now the offenders in child sex abuse. And at that point, when they're involved in law enforcement, then we had no choice but to shovel them through the system because there wasn't anything. Granted, this was quite a while ago, but I don't know if anything has changed that much. And I do believe law enforcement is very short on interviewing techniques for children and also understanding what to look for or how to talk to them to try and figure that out. So that's another place where I think relatively easily, if there were some better training for law enforcement on working with young children, where you might be able to divert it quickly.
Absolutely.
Quicker, not quickly.
And people have also talked about, like, what does it mean to also work with law enforcement and the education system, right? So how do they learn to work together? How do they learn to better understand if there's an altercation or there's a problem in school in which law enforcement is called into the picture? How do we work to say, hey, let's better understand what's happening with this young person? Maybe something's happening with their family. Instead of law enforcement saying, hey, we're going to just grab you and lock you up, we're going to take you to a place where, hey, you seem to have some needs that are being unmet. So instead of booking you into the system, we're going to book you into an appropriate program. Not book, but you know what I mean? Like, we want to get you in contact with an appropriate program to provide you some help. So there are a lot of trauma-informed schools that are really taking this approach and working collaboratively with law enforcement, child welfare, to better understand what's happening with young folks. Should they come into school and there's a problem, because there is that direct feed, and
Yes.
Once that feed begins, we have many young people who say, the education system didn't care about me, law enforcement, they didn't care about me. And then they look up and they're very aware, like nobody noticed these things were happening to me. And then next thing you know it, like I said, I work for an organization where just about all of the adults in the adult system said, this began years ago.
Yep.
I had touched the juvenile justice system a long time ago, child welfare a long time ago.
Yep.
And then they eventually land. So if we can figure out, better ways to collaborate and, build systems. And I know everyone is working really hard. It's just, we just have to continue to look for ways to improve. That's how I kind of look at this work.
Any other questions, comments? Yeah, well, thank you again, Shakira and Christy. And we would love to hear more if you get the grant that you applied for and you kind of start this planning initiative. We'd love to hear more about how that goes. Yeah.
Sounds good. Good to see so many of you.
Yeah, you too.
Okay.
Is Nikki's not here, I assume.
Nikki is not online.
Yeah, is anyone here from the conference committee who might be able to talk about any developments?
Yes.
Tana, okay.
Yes, and others who are part of it, feel free to chime in. Yes, Nikki did email saying that she was going to be out this week, this month. So the big things, let me just pull up my email to make sure. So we met with Heather last month. I don't know, I guess it's March now. Last month, around this, what would it look like to have Heather who could help do planning for the conference? What would that look like? So she kind of outlined her packages and things like that. But then we asked her what would be the first steps that we need from the task force to get that ball moving, because we're looking at April 2027. Yes. Yeah, my sense of time is really off. It's going quickly. April 2027. And so after meeting with her, what we wanted to kind of present to everyone here and hopefully make a decision is around conference theme, and then nail down some dates in April if we can. And the thing that I will say about the theme that we had, it kind of birthed from one of our full task force meetings, and then we expanded on it a little bit. We had talked about, I want to say maybe Paula, you wrote some notes that it's been several months ago, that month, around the continuum of services, or not just girls and women incarcerated, but at different touch points. We talked about probation, like kind of the spectrum, the lifespan. We don't know the right language, but that was kind of what we were hoping to reach more people and to have sort of the messaging hit all of these different systems. That's kind of what we had come up with. I think we're open. I mean, that's what we need to decide today around theme. So we were hoping that we could have a discussion about, do we like that theme? Do people have other thoughts? Yeah.
It's definitely broad and would incorporate a lot of potential attendees for sure. I mean, I think it would touch a lot of professionals and people with experience.
Yeah, I mean, if you think about it from the perspective of sort of like I don't know I think about it in my lens through the context of representing women, but it's like the system interaction with women from, first engagement with law enforcement, when girls, from the first brush they have with law enforcement, that could incorporate post and police and like how they can be more trauma informed. Then they come into like holding, right? So what does that look like when they're incarcerated at a JDC or when they're incarcerated at a, I think of like the Ramsey County Law Enforcement Center pending charges. What does it look like during the course of representation of the women? That's more of a legal systems thing, but also it touches on probation in the sense of like pre-sentence investigation techniques. What kind of assessments are we giving them to decide what their probationary conditions should be? Then what does probation look like? What does incarceration look like? And what does, release from incarceration look like? So, I mean, I think that's really sort of the life cycle of a person's engagement with the system. You could structure it like a presentation on each of those things. That would, I don't know how many things I touched base on, but that would probably be when I think about conference content, I think of like 6-hour blocks of per day. Like 3 1-hour presentations in the morning, 3 1-hour presentations in the afternoon, if we're just doing one track.
Yeah, I
But
like.
we could do multiple tracks.
I like the idea of all of the stages like Corey talked about, but I think it'll be important for us to also, like they're not siloed. Each one's not siloed. They're all kind of connected. And I think incorporating that connectivity throughout that set of stages, I think would be important.
Yeah, because that's the whole thing, right? We already are siloed. So in a way, having separate tracks or breakouts might do a disservice to the whole point. May we want everyone together and we want to have everyone experience it from start to finish so that we do that, get that like cross-pollination of experience.
Yeah, we've
because the women who go through the system experience it all, but we don't, right?
Yeah.
And maybe that's part of the problem.
Well, I think what you're hitting on is sort of, yeah, Angel, and then I'll be quiet. Was kind of our initial conversation of like, if we just talk about probation, right? There's all these other parts we're missing that the girl has, has touched, like you're saying. So I think, yeah, that's definitely kind of part of the point, is to show that how they're all connected.
Yeah. Angela, go ahead.
Is it Angela or Angel? Okay.
Angel, I think.
I do want to be able to address in one of those areas education for our youth and women. I know they have great education programs within the women's prison, but education for our youth and our young girls can be very difficult to keep track of. I do believe there's questions, especially from one who has personally experienced that, is who's collecting all that information and how it's kept track of. I think there's a lot of issues with youth in all of these places and their education that needs to be addressed too.
Angela, go ahead.
Yeah, I like the idea of keeping kind of everything together, because I think that in showing that we are siloed, and we can also show how we're interconnected, and also the big gaps in terms of oversight, which has been a theme, I think, in recent meetings, especially regarding girls. So I like the idea of, like, I think Corey mentioned it, like a life cycle of what this looks like for the young person impacted all the way through, and then being able to highlight ways we can improve. I don't know, that's.
Yeah, we have done conferences. When we had Brene Brown come, everybody was in the room, everyone together the whole day with, breaks, of course, but, and it went really well. Oh, Linda, sorry, let's see.
Oh, thank you. Oh, well, just following up on that comment, I was wondering, I don't know whether or not the plan is to have a keynote speaker or not, but would it be possible to think in that direction of a keynote who would have the expertise to be able to pull it all together, that here are all the breakouts that we're offering, but the keynote is this person who could pull it all together and make us take it out of the silos and put it into the systems thinking.
That to me seems like it would be somebody with lived experience, right? Who's been through it.
Yeah. Do you mean like kind of like an MC to kind of pull throughout the day, having different expertise, and that person kind of being is that what you're saying, Linda?
Well, that's a possibility. I mean, I've been at conferences where we have keynotes that, have the overreaching theme of what the whole conference is about, that is able to pull it all together. And as you mentioned, the idea of a person with lived experience, not that person necessarily wants to get up in front of a bunch of people and talk, but it could be that we could take a case study, a case of showing how this person went from here to here to here to here, I suppose that could even be a breakout, but I think it would be important for everybody. And rather than the person themselves getting up there in front of people unless they really want to, that even could be something that could be acted out or the story told by college actor, a community actor. I mean, somebody who does feel good about getting up in front of people.
There are a lot of people with lived experiences who are sharing their stories and do
Excellent.
so as part of like making a living. And I think it would be, I think we could run into problems if we were to try to make assumptions about what those experiences were. And I think we'd be better served to find somebody who's, you know, who's now kind of part of their healing is telling their story in a professional way. That is really powerful.
Yeah.
Absolutely.
Angel, go ahead.
Me, I would be one of those people to break it down of what it looks like. And I don't think I think a lot of things from back then when I was growing up till today is very similar. And I definitely have been through that healing process, and I would call myself, for my journey, being a successful woman in what it is that I'm doing today, and being able to be a part of the task force and a lot of other things as well. I would be more than honored to share what it looks like from the beginning and what we go through, and where I am today and what that looks like, because the navigation is difficult to do on your own. So that also addresses, you know, what is needed and for these women.
Savannah?
I was just thinking, depending on the size, it seems like in conversation we've gone back and forth with like how big it would be. But if there was an interest in having like breakouts or, you know, an opportunity for people to talk in small groups instead of like an entire day, you know, I've seen a couple of things before that was interesting where less about like the tracks. I totally agree with folks here around like not separating people by their track, but like just an assignment of like group A, group B, group C, and then flipping it and like shuffling them around for another group. And perhaps we on the task force could do the assignments and try to arrange people to not be all with their silo.
We could have assigned seating.
Yeah, you could do assigned seating.
I've done that at conferences before, and some people are like, what is this? But some people really like it. And if we want to have that cross-pollination, I think that's a great idea, Savannah.
And if there was, I think one thing that I'm aware of is different learning styles and people having different interest in speaking up in front of big groups versus a smaller group. And so if we're wanting to foster a little bit of that crossover, then a small breakout could be good, but maybe not with the like, here's your track and these are with the people that you're always with. That was my only.
Yeah, I mean, if we structured it so that each presentation maybe was 45 minutes, and then we have a prompt for discussion at the tables, and we have the tables intentionally diverse in terms of agency, that then for 15 minutes after the presentation, the tables would sort of discuss what it looks like from their various perspectives. I think that would do a really good job of unsiloing.
I love assigned groups, assigned seating. I always do that as a facilitator. I'm like, you people, let's go talk, you know. Yes.
Because otherwise people kind of sit together, and then there's always people that are the only one from their organization. They don't know where to sit, so they're happy for assigned seating, you know? So I think in those conversations is where the real learning kind of takes place, when people can talk and process what they learn.
How many people are, I know Tana, you're on the conference committee. Are there others on the conference committee here today? No.
I think it's just Angel, but I know Angel, you haven't been able to attend the last couple ones. I can't see who else. I think that's it.
Yeah, I mean, I think a lot of these ideas that are coming up and can continue, I'm not stopping the conversation. It would be good to just kind of make note of them and take them back to the conference committee that's really gonna have more, going to be more agentic and kind of putting all this together.
I agree. I do have one. I'm curious if people have thoughts, because I feel like we still sort of need to nail down the theme, because I like Paula, I like what you put in the chat. From my perspective, I think we need to decide, like, would it be this life cycle? I don't know if that's the right language or not. This life cycle of like social systems, or specific to like the justice system? Because I think initially we had talked about it's sort of staying within the justice, like Corey, you were saying, that process. I feel like, Paula, what you're saying is a little bit different. Do people have thoughts on which way we should go? Does that feel too broad, or does that feel good? Because we also are trying to meet more centrally in the state so that we can branch out to more people. So I still would like a little bit, if we can clarify a little bit more.
I personally think it's more concrete, if we can keep it to like the system cycle, cycling through the system would be cycling through the system would be almost like the title, perhaps, and then just do what that looks like from start to finish, because then it's all the people that are part of that system in the room together. When it comes from my perspective, I think that all the other broader things are important. They're things that we need to think about, but a lot of those things are so broad, they're so beyond everyone's control, that it's easy to say, well, that was very interesting, but it doesn't, there's nothing I can do about that. But when we're really rooting it into like our own organizations and how we touch the lives of women and girls, then we can't take ourselves off the hook as much. And we should hopefully walk away with some concrete ways to do better.
Yeah, I love the idea of cycling through the system. I can picture like a woman on a bicycle.
I feel like it's a hamster wheel, but
hamster wheel's even better.
Yes.
Linda, your hand's still up. Did you have more to say, or are you, okay, all right. Yeah, I really like that idea. I think it is concrete. I mean, the notion that these systems are all connected and one thing leads to another. And I think if that's the focus, then I think that is concrete.
Okay. Yeah, because like you were saying, Vicki, I think the breakouts and all of those conversations are going to come. We just need to figure out, the broader, what we want that to be. So cool.
Cycling through the system, is interruption possible?
Wow.
Okay, Corey. I love it.
I don't know.
Or girl interrupted.
Oh my gosh.
And Angelina Jolie is.
Yes. Who's gonna call Angelina?
Yeah. But yeah, I mean, I do think that is an important piece of it. It's like, because if all we're gonna talk about is here's what it is.
Yeah.
If we can talk about ways, like concrete things that can actually interrupt that cycle. Like what kinds of things can be done that will actually interrupt someone going from this stage to that stage. So yeah, I love that.
Yeah, I do too.
Okay, here you go. You're welcome. All these
Done.
good ideas.
What about dates? Can we decide on dates, or?
That's always
tricky.
So not fun, because there's 10,000 holidays. Every weekend has a holiday of some type.
So we're thinking April of 2020.
Yeah, 2027.
I don't have my little chart of. So what holidays fall in April?
The only one that would normally fall in April would be Easter Sunday, but that is May 28th in 2027.
Okay. Are there any days that are?
Or not May, sorry, March 28th, not May 28th. Thank you, Jeff.
What about doing it on International Women's Day? Do we know what that is? That's spring.
That's in March, I think. Isn't it in March?
Maybe it just
Yeah.
happened.
I do like that idea, Corey, but it just happened. So,
And I suppose March, the weather's a little fickle, right?
well, in spring breaks,
Yeah,
I
March
feel like all the schools
is when it
have
was.
different.
Yeah, okay.
It's also Women's History Month, Women's Equality Days, that's all in March, yeah.
I mean, this far out, unless it connects to Easter or some sort of weird school stuff, I think we could just nail it down.
Let's see. Love Your Thighs Day. It's April 22nd.
Oh, that's a day.
Well, it's supposed to be an empowerment, body positivity thing.
Maybe not the first, we can rule out the first weekend because that would be, oh no. Easter would be the last weekend in March. Okay, never mind.
April is International Black Women's History Month. The whole month.
Well, I mean, it would be a good opportunity as well then to talk about this through an intersectionality lens and make sure that we're honoring that piece and the overrepresentation as well.
Mm-hmm.
Yeah, I mean, so I guess what it comes down to is any time in April.
Yeah.
Right? So.
Are we thinking of Friday?
We've mostly done them on a Monday or a Friday, somehow connected to a weekend.
Okay.
Well, maybe what we need to do is think about Keynote and then figure out their availability. I know Angel has, volunteered, and if that's, the direction that you guys want to go, maybe connect with her, see what works for her and start, and your planner, see when they're available, and then the venue. You have to think about what venue you're having and when that's available. So I think as of right now, if we're thinking like Friday in April, you need to kind of run and nail down some of the availability of those other.
Yeah, and we had thrown around some ideas about a venue. So yeah, I'll take that back to the subcommittee and to Heather.
What ideas are you thinking of in terms of venue?
I don't remember, Vicki, like a community center. Okay. I wrote it down, but I don't have it with me.
That's all right.
You mentioned, sorry, can I ask a question?
Go, please.
You mentioned trying to do something that would be, I can't remember the phrase it used, more centrally located. What, can you remind me how you described that?
We were looking at St. Cloud.
Oh, yeah, that's right.
And there was a community center there that Heather and I'm drawing a blank on her name. I apologize. Angela Brewer had said she's done a conference there. So
we always end up using, when we do St. Cloud, that there's the Kelly Inn, but it's not, I haven't done anything. This year is the first year I'm going to do something there, and I don't know what their capacity is. It might not, but they are really close to it's like an event center that's close by there as well. Mm-hmm. But for hotel room block, the Kelly Inn is close by. It's cheap.
Okay. Yeah, they were talking about something like that. One of the event centers has a connection with a hotel.
I think that's it. I think it's the Kelly Inn, and I think there's an event center that connects to it. They also have meeting space, but the meeting that I'm using it for is like 60 people. So it's, I don't know if they have a bigger space that I'm not using.
Yeah, Linda, it's one day.
I can report back. I'm gonna.
Okay, yeah, let us know how it goes. But this is all helpful. I think this is good. This is what we needed to get the ball rolling.
I think in terms of numbers, Tana, with something this broad, with a topic this connected to so many different professions, I think especially with early promotion, I think we can look for 200 or more.
Mhm.
Yeah.
Yeah, we talked about that, like sort of doubling from last time. Wasn't like around 100?
Yeah, because but the ones prior to COVID were over 200. We were like 220. Yeah. So,
Okay.
and we had a really, a short amount of time to really do promotion for the last one we did. So, and we still got 100. So.
Yeah.
Yeah.
It will be interesting to see if moving it to St. Cloud draws more people, or if there are more numbers in the cities that then will not drive to St. Cloud.
We've had it in Duluth and it was well done. Was that right?
You got a good draw.
I'm trying to think actually now, was it that or that was the outstate meeting?
Yeah, was it in the summer?
No, but we did do the one, where was that one at that golf place or whatever that we said was really nice, but we wouldn't go back to because of the whole, remember? Can't think of who was there. Was that
So when we did like the
a country
wellness
club?
thing and everyone was
Yes.
mad about the squash lunch.
Yes.
I remember that.
I loved
Yeah.
it.
I thought it was
really
lovely.
good.
If people are complaining about the food, it's a sign that everything went well, actually.
It was more because it was a golf place and they're
Water waste
historically racist.
Oh.
Golf country clubs, yeah. So, but anyway, that's kind of an aside. But I think as long as we're not going like up to Ely or something, I think, I think people will travel. Sometimes people like to travel and maybe because then they can spend the night and get reimbursed.
Yeah. I'm not saying we don't do it. I think we should do it. I'm just like talking out loud curiosity.
Gotcha.
That's just something that I struggle with my own staff, because when we do things in the metro, the people from greater Minnesota complain that we're doing everything in metro. When we do stuff but they come,
Yeah.
but when we do things in greater Minnesota, sometimes it's a challenge getting the numbers from the metro, because the metro people have more numbers usually. I don't know if that's how it is with corrections as well, but.
No, MCA is always up in Duluth, and that's always, we send people when we can. And
The annual corrections.
Does it do well? Do they draw a crowd?
MCA every year. It's been a while since I've been
Yeah,
there.
I do think people will travel. I will. I'd rather go somewhere different than what I'm used to, where I'm used to being.
Okay.
And St. Cloud is a doable day trip.
It's not huge.
Yeah.
I know many years ago, we had it in Mankato and that's a long time ago, showing how long I've been on the task force, but it was focused on like drug court a lot, and it was well attended, so that was 100 years ago.
Yeah.
Yeah. Great. Anything else about the conference? Oh, Angel, sorry, I didn't see you.
I don't know if anybody knows this, but I actually live in St. Cloud. So I am very tied with a lot of the community here, from youth and adults, especially from the day-to-day work I do. I do reentry for adults. I also have just launched my own program for youth. I'm familiar with a lot of youth social workers, probations in Stern, Benton, and Wright County. So I would be able to share that information on your guys' conference when that is needed and when you guys need me to do that.
That'd be great.
Yeah. And let us know if you have any venue suggestions too.
The event center would actually be the best. My sister-in-law is actually the manager at that event center.
Perfect.
Awesome.
Okay, well, there we go.
It's a really nice event, especially if you're looking for catering for food. They do all of that as well. They hold their mental health conferences out there every year. So it is a really nice venue.
Do you happen to know if they can manage like over 200 people?
They can.
Oh, cool. Yeah, that's awesome.
They have a really nice stage set up and screens and all of that good stuff.
Check and check.
Yeah.
That's awesome.
Excellent. right. Tana, was there anything else you wanted to talk about with the conference?
No, that's it. Thank you, guys.
All right. Okay, so I guess I'll open it up for public comment.
If anybody, just raise your hand if you have any public comment, and I don't see anyone raising their hand.
Okay. Paula, are you still trying to get your colleague from Hawaii to come speak at one of the meetings about their model, youth model?
So I did talk to Judge Karen Radius. So she's been involved in the girls' movement for years and years. And she said that right now they're going through transition and they do not have the time to put something together, but she'll let me know when they would have time to do that.
Okay, that sounds great. For now, though, I think we can take it off the action list.
Got it.
But yeah, just let us know, because that does sound, that would be really great to hear about a successful model. All right, anything else? All right, I guess we're going to end a little early. So it was really great seeing or hearing from everyone. And I guess, next month, I actually won't be able to be here because I'm going to a conference in Jacksonville. So Corey's going to be leading, and I will see you then in May.
Yep.
So, all right, have a good month, everybody.
Bye, all.
See you.
Bye, guys. Thanks.
Is that INCHEP or a different one? I don't even know. No, INCHEP's not in Jackson.
No, it's sociology.
Okay.
It's a sociology